This opioid situation is completely out of control. The number of Canadians being hospitalized is up 30% over just 8 years. Like 13 a day are going into hospital, and there's a summit coming. I guess the question I want to discuss with you three is, what can the government realistically do? I mean, this is a painkiller that people need to be as a treatment, but it's being abused by youth. What's the answer here, Adam? Do you banish it, or what do you do?
The first thing is find out what's working on the ground to save people's lives. What's happening is a tragedy, and to the families that have lost people today, it breaks people's hearts. It breaks our heart. The second, so you pull people together and you find out what's working. We know that East Vancouver has had experience, that Winnipeg is having experience, Halifax is having a different experience. So you need to find out and share best practices very quickly. We've also provided, we've taken the antidote, delisted it from being prescribed and being a controlled substance, and made it more available quicker to folks that are unfortunately engaged in this on the street, but also folks providing care so that it's available more easily to save people's lives faster. The final approach has got to be harm reduction. You know, we came through 10 years of criminalizing drugs and making harm reduction strategies very, very hard in this country. That puts people's lives at risk. That attitude has to change. We're in the process of making those changes as well. There's a safe injection site coming to my riding. We need it in Toronto yesterday, not tomorrow.
Toronto's getting it, but Vancouver's the epicenter of this. What needs to be done? What are you seeing out there that could be given to Canada-wide and maybe help deal with this?
Well, I'll tell you, I think that all levels of government has failed on this issue over the years. We call for a 4 pillars approach: harm reduction. We call for enforcement, treatment, and prevention. And you know what? We have not done any of those pillars very well. And the truth of the matter is, we actually had the Harper government bring in Bill C-2 that actually slow down, if you will, harm reduction initiative, supervised injection facilities. And the Liberals actually, in opposition, chastised the Harper government on that. They're now in government and they have yet to repeal Bill C-2. Why is it taking so long? Why is it hampering communities, health authorities in moving forward to bring in a key pillar to save lives? And let's be clear, saving lives means this, so that people have a second chance to detox and enter into treatment. Dead people don't detox, and Bill C-2 does not help in any way, shape, or form.
Candace, what needs to be done?
Well, when we were in government, we looked at it in terms of, it's a prescription drug that's being abused, which is one of the largest abuses in Canada. Alcohol, prescription drugs, probably the top 2. So we went to doctors. We invested in research. We went, and so that doctors wouldn't be able to just prescribe it. We put on a ban so the pill couldn't be altered. Abusers crush it and they snort it or they inject it. Unfortunately, and I'm not sure why, but the Liberals have just reversed that. So it's easier for abusers to be able to crush it, to then snort it and inject it, which is now their reason is that they want to allow, they think that the result or the best.
No, I'll give the reason why if you'd like.
Okay, well, let me finish that. Thanks, Adam. And here's another point. You know, Adam said that the people in Toronto want to have what he calls a safe injection site, which, by the way, there's absolutely no way that it can be guaranteed as safe. What the Liberals are saying is that they want to take out consulting communities, and I know that there's a number of other issues involved in this, but communities, mayors, reeves, municipalities have the right to speak about whether they want to have one of these injection sites in their neighborhood. And I don't think that it's up to the government to supersede. They want to consult on everything. What about giving people drugs and having these sites where people are going to be injecting drugs at a long list here, Adam.
Be quick about it.
So the issue is this: is that the move to try to make them uncrushable is part of what's spawned the fentanyl dynamic, because other opiates became impossible to manipulate. And as a result, the addicts went looking for other opioids, and you can't keep up to the innovations that happen on the street. That's why harm reduction's got to be the strategy, not constantly,
give them more?
Is that
what you mean? Or
no, it's not what I mean at all.
Like
what it means is that we have a serious set of addiction issues in this country, and we've got to address it as a medical issue, not a criminal issue, in so many ways on the street. And the points that Jenny makes are absolutely fundamentally right. We have got to get on top of this issue from a harm reduction and a care strategy, because quite clearly the war on drugs over the last 10 years produced what we have now on the streets, and it's producing the tragedies, and we have not turned the corner on it, precisely because the strategies over the last 10 years failed, and they failed people, not just this country.
You're generally on the same page, right, Jenny?
And the urgency comes from Vancouver. I get that.
I think it's really important to focus on the evidence and the science. And in my own community, Insite has proven time and time again peer review after peer review that supervised injection facilities save lives. There has not been one fatal overdose since it opened. I think this is what we've got to get to. Like, I mean, I'm a mother and I just sit there and I shake if I think that my child is going to try drugs and the first time that my child tries, that they actually die. We cannot let this happen. And this is what's happening in our communities. So let's set aside whatever feelings and personal judgments that we might have on the issue and to say, look at this from an evidence-based health perspective and let's save the lives. Let's get into prevention and treatment and enforcement. All four pillars working.
Addiction has to be addressed. And I mean, that's overall where it comes to our, whether it's, you know, homelessness, whether it's criminal activity, absolutely mental health, addiction has to be addressed. But I think, but I think though, in terms of this so-called safe injection sites, I think that there is room for consulting and talking to communities. We want to talk to communities about every other issue. I don't think that communities, municipalities
requires a burden of proof that is so ridiculous.
There has been, it's been sad though. I mean,
the courts, by the way, have ruled and that people should access healthcare facilities and supervised injection facilities and harm reduction is part of that program.
There you go. All right. This debate is going to rage on Friday. I can see that at the summit. So let's hope something can be done because this has got to stop.